So let's talk facial anatomy and the layers of the face. Now, if you don't know that the face is made up of 5 layers, then you've been hiding under a rock somewhere if you're an aesthetic practitioner. But essentially there are 5 layers of the face: the skin, the subcutaneous tissue, the muscle layer with a superficial muscular aponeurotic system that is invested around these muscles, the deep fat pads along with the ligaments, and these are the spaces, and finally layer 5 of the face is the bone. How one layer ages affects the other layer, almost like a domino effect. You'll always hear us talking about, the layers of the face are like an onion ring, and these 5 layers are stuck together. And this is all fine in youth. But by the time you are in your mid-30s to early 40s, what happens is layer 2 along with layer 1 is sliding off. Layer 4 and 5 of the face is deflating. The deeper tissues are atrophying. This atrophy is very visible again in the mid-face, in the angle of the jaw, the chin, the eye sockets. But layer 1 and 2 of the face atrophies, and in some areas it hypertrophies. So particularly the nasolabial folds, the eye bags, the jowl fat, the submental fat. And this sags, and so it's sort of, think of the anatomy as a beautifully stacked hamburger. And it's all stacked up when you create the burger. And then it sort of starts sliding this way, and that's what's happening to the face. How does this help you plan your treatment? So you've just got to think of a little treatment plan that's like a pyramid. You have to have some basic skin care that's in place, which is going to be looking after layer 1 of the face. And you can use a simplistic model that in your 20s it's skin care, then you up the ante with your PRPs, your microneedling, your peels in your 30s and 40s. You move to the energy-based devices like your lasers or your fractionated radio frequencies or your plasma, your Tixil as you get older. And then eventually you might need to have surgical correction where that skin is just being excised, and this is in your late 50s. So this is layer 1 of the face. Layer 2 of the face is only safe for me to inject with a cannula. I would never inject with a needle in free space in layer 2 because this is risky, and it's particularly risky in the central face, this central corridor of the forehead, the glabella, the superior sulcus inner corner, the tear trough inner corner, your nasolabial folds. If you're going to inject layer 2, which is a subcutaneous layer, with needles, it's dangerous. I would only inject with a cannula in this layer. And again, you've got to put a product that is a very viscoelastic, that allows dynamic movement, because this is the area of the face that moves quite significantly. We don't want it to be a very hard, a very cohesive product that's put in layer 2 of the face. Layer 3 of the face is your muscles. Of course, this you're controlling with your ibobotulinum toxin or your botulinum toxin injections. And you're also tightening the SMAS as you get older with various energy-based devices. And what are these? From your ultherapy to the layer above that with your threads, with your fractionated radio frequency, and even with surgery, because you can do your little SMAS lifts surgically and tighten them with stitches. When we go to layer 4 of the face, we know that these are more static compartments, so they're not that dynamic, they don't move, they're not in the mobile areas of the face as much, but they're important for structural support. So really in these layers, which is layer 4 and 5 of the face, we want to use a highly cohesive product that has got strength, that can project and that can support tissues, but is not going to go. And so this is where you start using products and the rheology of the product, so that you're putting the highly cohesive lifting products on the bone. I'm okay with using a needle because obviously we're touching the bone. This is a pre-periosteal filler placement, and the filler goes up and fills up the space. And it's a safer technique to use a needle. You can also use a cannula. All you've got to remember is a needle is not safe if you're injecting it where the foramina exists. So, the infraorbital foramina, the mental foramina, and the supraorbital foramina.